Should we get started?
Yeah.
Okay. We'll get started. Everybody doesn't know, this is Skyla Hamilton-Holderman. She's a local RN, used to be a school nurse here in Lincoln County School District number 2, and now has branched out to Alpine Opry Nurse Concierge. Thank you. But she's volunteered to come here and do a program loosely based on this book, Hormone Havoc, which has a lot of good information in it. And yeah, and also it's the first of a series on women's health. I believe Brittany Quinn's going to do the second one in February. I don't know the topic yet.
I don't think she does.
Okay, all right.
Maybe it's
going to
just
be
general overall female health.
Third Thursday in February, and then we're going to have a third women's health series topic in the third Thursday of March. So look for those. When we have more information, we'll put it out to everybody. So welcome, and thanks to Skyla.
Yeah. And just some housekeeping tips on your seat. There is a discounted trip over to our office. So we have a couple different businesses located over there. We've got Mountain Oasis, we've got Alpenglow Aesthetics, and soon to be Fairy Peak Wellness. We have Fairy Peak Women's Health, and we also have Spa Anew. And definitely come on over. Our office is right next door. Check it out. Come in, take a tour. We'll give you a tour at any time. And then also, we wanted you guys to sign up your name, your email, and at the end, there's going to be a drawing, and somebody gets to win this book, and you get to take it home. So, yeah, we'll just jump right in. And then if you guys have any questions, feel free to write them down on a slip of paper. You guys can put them in this jar if you want, as well as you on Zoom, you guys can write it into the comments. And if I can't answer anything immediately on the spot at the end, I will get back to you and I will give you a full response if it's an in-depth question, or if you want to follow up after this talk. So I'm going over this book. It's called Hormone Havoc, and it's by Dr. Terri DeNeui. And I just found it really inspiring, and it touches on a wide array of topics. I am literally just going to scratch the surface on the iceberg. The rest of it is down below. Feel free to order this book. Typically, it is available on Amazon. It's kind of a made-to-order book. I think that's how they're able to keep the pricing down on publishing and so on and so forth. And so you just go online, you can select Hormone Havoc, and it can be shipped right to your door. It's roughly $17, just so you guys know. But yes, we are incorporating a lot of these aspects into our practice over at Fairy Peak Women's Health and Fairy Peak Wellness. And Caitlin Alley is also associated with Fairy Peak Wellness. And so if you guys have any questions, raise your hand, Caitlin. You gotta. Thank you. And so we are all partnering together to help give you guys customized healthcare in the Valley. That's what we're shooting for. So here we go. Oh, hold on. Let me get to the right spot. Sorry. And so overall, this is a dedication for everyone and anyone who has been plagued with a health issue, sought answers in many places from many different people, only to think you must be crazy because you've been told you are normal, nothing is wrong. This book is for you. And so the history behind the Women's Health Initiative, this was a trial that happened, and it was performed on women, and it was a trial of synthetic estrogen and progestin. And unfortunately, through this trial, it created this unfounded fear of hormone therapy in women, that it would cause strokes, Alzheimer's, osteoporosis, heart attacks, and breast cancer. Of course, that sounds super scary to anybody reading And so this study was designed to start in 1991 all the way until 2005. Unfortunately, in 2002, the front cover of Time magazine, The Truth About Hormones, Hormone Replacement, it's riskier than advertised. What is a woman to do? So that happened then. So this study had been, the Women's Health Initiative, had been going along. And then in 2002, the media got a hold of it, and then everybody shut everything down. And this study was based on women who have had hysterectomies, meaning their uterus has been removed, and a woman who had not. So there were two arms of the study. The people who had hysterectomies were placed on equine horse estrogen, referred to as Premarin. And then the people who did not have a hysterectomy was placed on Premarin and progestin combo, which was called Prempro. Progestin is often erroneously referred to as progesterone. In the Prempro combination group, the medication must not be confused with your naturally occurring progesterone that happens in your body all the time. So the primary intention of this study was estrogen replacement therapy. Was it preventative for heart attacks and death? That was the number one. Number two, the secondary intention was to examine the safety of the therapy as it pertained to invasive breast cancer risk and determine the impact of hormone therapy on osteoporosis. The trial came to an abrupt halt in 2002 because the invasive breast cancer risk Prempro group exceeded the boundaries for safety. So they just shut everything down. The Prempro, or the estrogen and progestin combination arm of the trial, showed significant increased risk of breast cancer, heart disease, Alzheimer's, and stroke. The Premarin, the estrogen only arm of the trial, showed protection against breast cancer, Alzheimer's, cardiovascular, osteoporosis, colorectal cancer. So there were all these benefits in the other group. Unfortunately, the results were all banded together of all the therapies under one umbrella. And rather than two separate arms of the trial, because the media said all hormones are bad, and everyone just stopped at once. The providers stopped ordering any hormones for anybody. Everybody like literally flushed all their hormones down the toilet or threw them in the trash and got rid of them. So the effects of hormones on overall health. Hormones impact physical and mental health, influencing energy levels, stress response, emotional well-being. Imbalances can lead to a lot of different health issues. So there was a case study, and it's specifically in this book. Bobby, who is an older woman, she was married to a gynecologist. The daughter of Bobby was a patient of Terri, the doctor who wrote this book. And the daughter, her marriage was on the rocks due to malcontent in the marriage, due to just overall hormone decline, that as you age, your hormones do decrease. But the treatment plan that Terri initiated changed this woman's life. She was on prescriptions such as antidepressants, and that led to weight gain. Her libido, her sex drive was non-existent. She wasn't moody or depressed. She was emotionally apathetic, just like completely a blank slate. And her husband and her children felt that the prescriptions just made her worse overall. Terri took her off the prescriptions and optimized her hormones, found the root cause of her libido, weight gain, and emotional apathy was all addressed. The clarity that came with that treatment plan allowed her to recognize the same misery in her own mother, who she prodded to receive treatment. 4 weeks after receiving treatment, Bobby, the mom, she stated, I have not liked my husband for over 25 years. Yeah. And now I realize it was me, not him. And she was sad about the lost years, but excited about her newfound vitality, joy, zeal for life, and sex drive. And then Bobby's husband came in and talked to Terri and said, thank you for giving my wife back. This was the gynecologist. Had I known about hormone replacement therapy, HRT is how it's referred to, while I was practicing, I would have recommended it to everyone based on getting my wife and my daughter back. Now I'm here to receive hormone replacement therapy for myself to keep up with my wife. So the causes of hormonal imbalances, they can arise from several different factors, including stress, poor diet, diabetes, thyroid disorders. Environmental toxins play a large role. We are inundated daily in everything that you do by environmental toxins. Hormonal medications may also disrupt the delicate hormonal balance in your body. So the symptoms of imbalances can vary widely, including fatigue, mood swings, weight changes, irregular menstrual cycles in women. Men may experience symptoms like decreased libido, muscle mass loss. In highlighting the campaign for awareness in both genders about about potential hormonal issues. So common disorders related to hormones are polycystic ovary syndrome, which is also referred to PCOS, thyroid disorders, adrenal insufficiency. These conditions can lead to significant health issues if left untreated, necessitating early diagnosis and management. So you can receive a large impact on hormonal imbalances that can impact your physical and your mental health. These can adversely affect you. They can lead to chronic illness, fatigue, anxiety, depression, emphasizing the importance of recognizing and addressing these imbalances as part of is a large part of holistic healthcare. So male clients can feel decreased zest for life too, similar to Bobby's husband. Inability to focus and concentrate at work, joint pain, irritability, food cravings, weight gain, lack of desire to engage in things that they love. These are just some examples: hunting, fishing, golfing. But anything that they truly love, they may become apathetic and not enjoy those anymore because of the hormonal changes that happen. Men rediscover life when hormones are optimized. Women experience hormone optimization quickly, and then a lot of the time, a woman might seek out help, and then her husband is like, oh, wow, that did such amazing changes to you. And then they seek out help as well. And then both in the couple are able to optimize their hormones and get back to where they were. Terri mentions that several people in marriages had divorce papers on the table. And then once both parties got their hormones optimized, lots of times those got ripped up. I'm not guaranteeing it for everyone, but I found that uplifting. And so in order, then both partners can enjoy life again and find a zest for life, energy, and sex drive. And so testosterone, so on your cells from your head all the way to your toes, there are all these receptors on each individual cell. And testosterone is one of the largest sex hormones that is all throughout your body. And those cells have testosterone receptors on them. And so a case study about Brad, he was a young male patient, retired from the military, a paratrooper. So you could picture it at the height of his career, super fit, jumping out of planes left and right, doing all kinds of things. And then he went into a debilitating depression, fatigue, erratic mood swings, and extreme anger episodes later on in his career. His wife eventually had to become the primary breadwinner, while he sought help with all of his both physical and mental ailments. Doctors at the military could not find any answers for him. He continued to gain weight, which worsened his depression and self-worth. He became a nightmare to live with, and everyone tiptoed around him. In the household became very, very intense. His wife heard about Terri's clinic and realized how low testosterone potentially could be the culprit. After an evaluation of blood work and in history of several concussions, he had what was diagnosed as intestinal permeability, also known as leaky gut syndrome. Treatment began with testosterone, and then he also addressed the nutritional gut and other deficiencies for the first time in 4 years. The husband and wife saw hope for the future. When Terri saw him the next month after receiving that initial treatment, Brad was unrecognizable. He tried to tell his military doctors about everything that he had learned and gained, but unfortunately it fell on deaf ears. Testosterone is one of the most abundant hormones in both men and women. Head to toe, testosterone impacts the body more than any other sex hormone. Testosterone is shown in many clinical studies to aid in the prevention and treatment of diseases like heart disease, Alzheimer's, depression, and other mood disorders, breast cancer, prostate cancer, memory and cognitive decline, diabetes and insulin resistance, chronic and acute pain syndromes, and osteoporosis. So there are some cases of where people are debilitated so much that they have such difficulty just going up and down stairs. And I have a friend who just recently received some testosterone treatment and used to only be able to hike for a few miles in pure agony, and now is hiking upwards of 20, 24 miles up all the peaks surrounding and finding new vitality for life. A balanced diet and rich in nutrients such as healthy fats, proteins, complex carbohydrates can regulate hormone production and help support hormonal function and promote overall health. So lifestyle changes, adequate sleep, stress management, routine health checkups are critical for maintaining hormonal health. Practices such as mindfulness, yoga, and time management contribute significantly to emotional and physical well-being, directly impacting hormonal balance. Regular physical activity can significantly influence your hormone levels by reducing the stress hormones and boosting endorphins. All of that can also help regulate insulin sensitivity and hormone production. So medical interventions for hormonal issues. When lifestyle changes are insufficient, medical interventions such as hormone replacement therapy or medication may be necessary. These treatments require careful monitoring by healthcare professionals to tailor the approach to the individual hormone needs and health status. So personally, I was just going about my business, getting older, and I could tell that my hormones were coming down a little bit. And I was having some issues such as decreased libido, weight gain, and overall just like not feeling myself. And I don't know if that resonates, but, and also I was falling asleep, like exhausted by 2 o'clock, like just completely exhausted. And then I was able to go in and I talked to Brittany Quinn at Fairy Peak Women's Health. And she checked out my labs because I thought it was normal, and I thought it would be within normal range. And I looked at them, And I'm a nurse, so I was like, oh, that's just a hair off from normal. And in regards to my A1C, which checks on your overall blood sugar and sees it analyzes how over 3 months how your blood sugar is doing. And then secondly, I looked at my testosterone and it fell within normal range. So I was like, that's normal. And then when I reviewed it with Brittany, she said, actually, your testosterone, you're at this level, but if we bumped you up to this level, that's where you would feel good. And I was like, okay, I'd like to feel better than where I am right now. And then she also said, yeah, your A1C is just a point higher than where it should be. However, if we allow your body, like with some medication, such as metformin or some other GLP-1s, if we start that out, you can go on it and then you can make your body realize that you have sugar in your body and recognize that insulin versus becoming insulin resistant, where the body doesn't recognize that insulin and trying to push that sugar back into the cell. So with that, then I was able to, and she's like, that's not lifelong medication that you're going to go on. It's just for a period of time until you're able to get your body retrained. And then you start losing weight and start feeling better about yourself. And then you can progress forward. And so with those changes, I will say my libido has come back. And then I have lost some weight and I just feel as though my body is moving on the right track. And that, if you guys can glean any information from that, because I do not want anyone to feel as though they need to suffer alone. That's the worst part. You just to be like, all these things are happening in my body, and I do not feel like the same person I was even like a year ago or maybe 5 years ago. Like I would like to find myself again, just like Bobby's story. So, and also maybe you have some angst towards your partner or something like that. And maybe it's stemming from you. And then if you're able to fix those or work on those things to get to an optimal level, then you might be able to reconnect with that person and not file for divorce or whatever. Those are extreme examples, but yeah. So monitoring your hormone levels and doing regular testing of hormones is essential for diagnosing those imbalances early. And we'd rather have you guys do it right now. Like, I want you guys to get back into life and start living life to the fullest, because there's a lot of life out there and you want to feel good while you're doing it. And so, such as blood panels, saliva tests, can provide critical insights and guiding treatment and lifestyles, adjustments to restore hormonal health, hormonal balance and health, and get them to the optimal levels. And so some other case studies, there was a woman in the book who had chronic menstrual migraines. She had sought out multiple doctors, even spoke to a neurologist, multiple medications to no avail. After 4 weeks of hormone treatment of the first dose of testosterone treatment, her migraines completely stopped. So she had been coping with migraines every single time her period came around, and then she was able to stop the migraines with that hormonal optimization. Breast cancer survivors, right when this study was stopped, they were told that they were never allowed to have hormones again. And lots of women felt very hopeless and subjected to a life of misery at that point. But now, since the new studies are out that it is positive, they are now working with hormone replacement treatment and living a full life because of testosterone therapy and feeling good. Terry's providers know that testosterone is vital for female hormones, and it has been shown in clinical trials to be a breast protective and maybe even a prevent breast cancer. Multiple stories of couples who had not been intimate for decades, and after the wife transitioned through menopause, it just hurt too much to have intercourse, not to mention desire was at a complete low point. And then with some hormone replacement treatment, they've been able to become intimate again. And then story after story of chronic pain sufferers who had diminished quality of life, similar to Brad's, only to be further exacerbated by hormonal decline, secondary to their pain and medications they were prescribed. Some patients were unable to walk up and down stairs without agonizing pain, but after 2 weeks of treatment on the right form, the right dose of hormone therapy, the patient reported joint pain completely gone. According to the American Public Health Association, the US performs poorly on most measures of health compared to other high-income countries. The US spends more on healthcare, but has worse health outcomes across age, gender, comparable to the same income groups across the world. Why is this? What can be done? It is Terry's a fervent hope that by the end of this book talk, you can start making inferences for yourself about what you can do about it. First and foremost, when a prescriber hands you a prescription for a medication, lab, diagnostic test, treatment of the problem, is the root cause depression, selective serotonin reuptake inhibitor medication, or am I suffering? And this is like Terry making light of the situation, but do I have a Prozac deficiency? Am I not able to sleep because of Ambien deficiency? Is the root problem of my anxiety is Xanax deficiency? Is the root cause of my ability to focus ADD deficiency? A deficiency of the central nervous system, stimulant, Concerta, or Adderall. Millions of examples, but you guys get the point. Don't get Terry wrong. Many of these medications have been lifesavers for many people during times of crisis, but that's exactly what most medications are intended for. Temporary solution of a problem while the root cause is being addressed. Many medications were not intended for long-term use to band-aid a symptom. So unfortunately, most people find themselves perpetually on these meds that are not fixing the problem, the root problem. What is worse, they may cause other problems, and then you may need another prescription for the subsequent problem. So this book will take you on a journey that provides key information on dispelling myths about sex hormone therapy for men and women, but about the exploration of additional key hormones and nutrients that play a large role in whole body wellness. Yeah, and that's it.
Awesome.
Yeah. So if anybody has any questions.
I have a question.
Yeah.
So is it suggesting progesterone is not the best or not necessarily?
So that particular study, because they were both horse hormones, is that particular study went to the dangerous side because it was horse hormones, not human hormones. And so the fact that what we promote and what has been found to be safe is that when you're using like to like, similar like hormones that are human hormones of testosterone, or you had progesterone, which naturally occurs in your body, that would be beneficial. That's another reason why the study was thrown out, is that it wasn't like to like. They were substituting this other hormone just to see how it performed in the study, and that's where it went to the dangerous levels. But overall, if you research and find out your own blood work, then there are like similar hormones that you can be prescribed. And there's many different modalities in how to receive them. Sometimes they are lotions that you rub on. Sometimes they're pellets, which are inserted just under the skin, and they slowly release over time. Some are injections with a needle, and some are supplements that you take orally. Yeah, so there's all various different modes to get you those hormones that may be declining.
So bioidentical hormones,
Correct.
so that's what you're describing as human.
Yes.
Okay.
Yes, correct.
This is all determined with the blood test.
Yeah. So you guys can get blood work. So St. John's does it. Star Valley Health does it. We do it as well. And when you do go and talk to any of them, I would say that you can, or you talking to your provider, tip is that you can ask for a cash based, and they'll give you the lowest cost to get that blood work done. And if you have any questions, definitely shop around, ask around, and so that you can get the best bang for your buck. We don't want you to spend more than necessary, just so you know.
If you hadn't already, can you talk about the difference between the saliva test and the blood test?
So, and actually, Caitlin, I might steal you if you're more versed in it. But overall, typically the blood tests, the way that it has been working in the lab. Are you saying, sorry, you're talking about, now I got you. So we typically work in blood tests, and that's where the measurements are and the parameters are. I'm not as well versed in the saliva tests. I do know for genetic, like to find out your genetic history and how it may lead up to like cancer, like whether you fall into those categories. I know typically they do saliva tests for that. I'm more knowledgeable about the blood tests, and sorry, I can do some research and get it back to you.
Oh, that's okay.
Yeah.
And cortisol levels have to be tested with your saliva, right?
Correct. You can, so that is one that is with saliva and or urine.
Okay.
So yes, that's how it can determine your stress levels in your body, your cortisol. Yeah.
I have not.
How often would you say that you need to test your hormones through a blood test to kind of,
To find out where you are,
Yeah.
and then if you go on bioidenticals to see where you are, I would say initially get the first one, find out where you are, get your baseline, and then you can start treatment. And typically, just through personal experience, I would say if it feels as though things are going right, you can go a month and see where you are again and see what's going on. Otherwise, you can go 3 months. And realistically, your provider is going to be the best person to give you that guidance. And especially if you don't feel like it's working or anything like that, then I would recontact your provider and find out.
yeah, and I was just gonna say too, the hormone blood test is just a quick, you don't have to fast, they just test your, just those 3 things, and it's quick and easy, and
Yeah. Depending on what you're seeking, but yeah. It's quick and easy, and I will say Jerry does a really good job, and it's quick and easy.
She does.
She did.
And Wayne does too.
Yeah.
I've been in Wayne's chair many times, so yeah.
So perimenopausal versus post or menopause.
you know, somewhere in between there is where I'm at. It, you know, lots of things are changing. So,
Yes,
I mean, I've been on progesterone for over 10 years.
okay,
And every time I ask, should I still be doing this? How do you feel? Oh, I feel all right. Okay, well, just keep doing that. So I'm just wondering, you know, at some point, probably things are gonna change in 10 years.
yeah. I would,
So, yeah, I'm wondering, I guess, what? Just keep, I mean, I did just take a test.
Okay.
So,
perfect.
yeah, but
And they said, you're
they said
fine,
just
keep on,
taking it.
keep on, keep it on.
But now I'm getting hot flashes. Symptoms are changing, I guess, is what I'm saying.
Yeah.
So I guess, I don't know.
Yeah, I think you can, yeah, and I'll get back to you on that one.
Okay.
Yeah. Yeah, there's lots of different factors, and so you definitely want, yeah, sometimes it just takes fresh eyes to look over your labs and just with the knowledge base and be like, actually, if you did this and that.
Yeah, it just feels like it needs to be tweaked a little bit.
Yeah. And know, like, you guys know your body the best. Like, don't let anybody tell you different. And that's why I say nobody deserves to suffer alone. If you feel that something is wrong, speak out. Just like FBI, see something, say something. And so talk to your provider. And if you're not getting the answers or they're not validating your concerns, Brittany has an awesome pin. It's like, listen to women. And that's what it says. Like, I listen to women. Because lots of times you will notice, similar to that case study on Bobby, the daughter was brushed off and told, oh, that's not your root cause. Here's some antidepressants. And then she gained weight after that and like felt horrible and was lashing out at her family and things like that. And that wasn't necessarily the answer. And so then once she got down to her hormones and was able to find the root cause of that, then she was able to feel better, have that vitality, and everybody deserves it. So if you don't feel as though somebody is pointing you in the right direction, seek out another answer. And I'm not saying, like, in the industry, we call it doctor shopping or something like that, but you are trying to find the answers for you. And I just want to let you guys know that there are providers in all of the valleys here that will support hormone health and help you get back on track. So I don't want anybody to suffer alone, because it's not fun when you're like, what is wrong with me? Why am I reacting this way to my kid? Or why am I reacting this way to my husband? And just like Bobby's mom, Bobby was like, oh, it was me this whole time. And it was just the hormones were off. And men are affected by hormones too. Don't let them tell you differently. They totally get affected, and they might have outbursts as well. And that's them showing their hormones. It's not like on a cyclical monthly situation, but they are affected by their hormones as well.
And the hormone therapy, do you typically like stop taking it once you've gone through menopause?
It all depends. Like, there's many, like, it's individualized, customized healthcare. And so you can keep on like just tweaking. And for example, like, I have one friend who's already gone through menopause, but having all these major issues such as brain fog, has GI upset, all these things, and not able to pinpoint it. And then once she was able to get her labs drawn, come to find out it has to do with the thyroid. And her thyroid, once that got more set on track, then she's like getting off the couch. Like, she could barely pull herself off the couch. Every morning was like dragging herself out of bed. And yeah, nobody needs to be there. And she went to all the specialists, everything from cardiologists to all the full gamut. And everybody said, your labs, you're in normal range. You're in normal range. And also, yeah, she wasn't. And she knew it inside. And then once they were able to pinpoint that issue, then she started to feel better.
How expensive is testosterone as a a prescribed?
Bioidentical. So
Yeah.
one example for the cream, locally, it's roughly 100.
For
Okay.
3 months.
Yep. Well, for a tube,
Yeah.
yeah, and it can last depending on,
Your dose, I guess.
yeah,
Yeah.
yeah.
What's
yeah.
bioidentical mean?
So just meaning that it's identical to our hormones as a human, whereas that study was giving horse hormones
Oh, right.
to women. And so that's why there were issues with that and it made it unsafe. Whereas bioidentical, you're taking on those hormones and they match your own and you're just increasing the hormone level. As it decreases as you age, then you're able to bring it back up to the levels that you felt good.
Have you found that insurance plans cover some of these costs and prescription costs, or is it pretty much kind of out of pocket?
I think it's attached to whichever premium you have. You may be able to, into individualized health insurance, health coverage. You might find you'll get reimbursed for certain things like that. I do know HSA plans, sometimes you can pay for your testosterone or bioidenticals that way, and it is covered. So you kind of have to, it's individualized. That's what I've seen.
Is there any Wyoming state funding for this sort of,
Not that I know of, but I can look into it.
or we could start with?
Yeah.
Okay.
Yeah. We could definitely, we're a bunch of women together, we can make anything happen.
Yes.
Yep.
True, yeah. I know for like my husband who does some testosterone, the labs are covered in his testing, but he has to get so much, but
Awesome.
the actual therapy is not like the.
Okay.
Is it super expensive or?
It's about 180.
Okay.
Okay, and how long does that typically last him?
1 month.
1 month.
Okay, one month, 180. Yep.
But yeah, he was not able to walk upstairs and so we were having problems with his knees a ton. And now he's like hunting was not fun and he didn't want to go hunting, but he's able
That's incredible.
to do all that. So yeah, it helps a ton.
Yeah. How about his mood? Is he happier?
Yes.
Excellent. That's beneficial for everyone. Yeah.
Exactly. So
Did he do the testing locally here? To kind of
he
figure out what he
went, he goes to Idaho Falls because somebody that he knew was going there. So
Do you think it's worth doing baseline testing or wait until you feel weird?
I would definitely encourage baseline testing, just so you guys know. Just so then, yeah,
Cause you wanna know.
Yeah.
yeah,
what you're trying to-
Yeah.
Like what's normal for you when you're in your peak.
yeah. And also, because of like our environmental toxins and everything, younger and younger people are being affected and their hormones are more out of whack at younger ages. There was one study where it was a small pool, but it was like 12-year-old girls and how much they were exposed to all the environmental toxins just in their daily care of their shampoo, their makeup, their lotion that they put on, everything like that. And then they just swapped them out for, I think it was like a couple days, for things that were less toxic. And it was quite a large difference in how they were affected by those environmental toxins. But of course the pool size was really small, so you're not going to hear about it in a lot of papers, but even just small little things like that, you can notice a difference.
I think that's such an important point because some of the lifestyle stuff that you mentioned, I love that you kind of put that first in your presentation too, is that it can be super depressing that these toxins and endocrine disruptors are like so ubiquitous, but there is a lot of low hanging fruit in our lifestyle that we can really get like 70–80% of the way there in repairing our hormone situation. And then your hormone replacement therapy could be a little bit less dramatic and you can really maximize the benefit there. If you kind of use those approaches in tandem, and before things really go to shit is the best time to start. Because then you gotta jump on it and then you need a little bit less repair down the line.
Yeah.
You know?
Yeah, definitely. And that was one example that, when I was talking to Brittany personally about mine in my A1C, she's like, I was like, oh, I'm just a point off. So obviously, like if I had been at a traditional doctor's office, they would have waited until I went over that threshold to start giving me medication versus preemptively starting. So then I don't even have to go there. I can start repairing my body ahead of time before I go into full-on diabetes, or I'm still in the pre-diabetes and I can get it back to where it should be. And obviously that's our goal. We wanna live a healthy, long life. And one example, like people have the potential to live to 125. So if that's the case, you wanna be feeling good. You know what? 125 years of misery, or the last 75, you wanna feel good and keep your body healthy so that you can live up to those standards. And who knows, even if you have kids later on in life, maybe you'll see your great grandchildren. Who knows?
So once you start HRT, are you supposed to have like periodic blood tests?
Yeah.
Like how often, like once a month or quarterly?
Quarterly, it all depends. Like if it's not working on that first month, you might have to tweak it a little bit. Also, it depends on the mode, your dosage. There's all these different factors. So, and I don't want you guys to be afraid of getting, like, maybe you've had really expensive lab testing in the past. And I just want to reassure you that there are inexpensive lab testing that is available. We offer it at ours, and there's several different other locations that are available, just to let you guys know.
And you can ask for pricing before you.
Yeah, and ask for cash first, because technically all of the different suppliers, if you go for cash, it's gonna be less. But when you do that cash, make sure you get the receipt. Because I've heard of some inconsistencies. So just do that, and then you have your receipt, and you can present it to, you can even present it to your insurance company too after.
So your standard blood tests, like what do you test for? I guess like estrogen and progesterone and.
Yeah, as well as we have
bunch
it,
of other stuff.
and realistically, it's like whatever complaints you might come in with, we're gonna tailor that blood test to exactly what you're looking for. And yeah, testosterone, also A1C, just to see how your body's reacting to your sugars, just your food that's coming into your system, whether it's staying regulated or whether it has dysregulation going on, all those different factors. Yeah. Yeah. And like I said, overall, it's going to be customized healthcare to what you need to make yourself feel better. And then, yeah, and at our clinic, we can take both men and women. So if you're like, oh, I feel better, let's get my husband on board. We can take him. Just so you guys. Forever. Forever, ever.
Drop off adoption centers. Sorry, Wendy.
You can't live there, no. Yeah, but Caitlin, do you have anything you wanna pipe in on? Okay, thanks. Okay,
Are there any online questions?
Yeah, I haven't
or-
seen any chat
okay.
questions